Hello and welcome. So today's topic is our middle ear, as you can see in this photo. So this is a space or a gap area in between the outer ear and inner ear. On coronal section, it is a biconcave structure. Okay. Now in measurements, as you can see in this photo, it is, as I said, it is a biconcave structure. So the vertical length is almost 50 millimeter and anteroposteriorly also 15 millimeter. Okay, but in horizontally at the roof it is almost 6 millimeter, at the base it is almost 4 millimeter, and at the center it is almost 2 millimeter. Okay, middle ear has three parts. One is epitympanum, mesotympanum, hypotympanum. Okay, epitympanum means the part or the space above the tympanic membrane, as you can see in this photo, which consists the head of the malleus and the body and the short process of the incus bone. As I said, this middle ear consists of three important bones. One is malleus, incus, stapes, and hypotympanum. It is present below to the tympanic membrane, and in between this tympanum you will find middle part or the mesotympanum, which consists of handle of the malleus, long process of incus and stapes bone. Okay, now the boundary of this middle ear, the roof is formed by the tegmen tympani, gone. The floor is formed by the under surface of the temporal bone. Here you're going to find jugular fossa and the bulb of the internal jugular vein. In anterior wall, it is formed by the bony carotid canal, which consists of internal carotid artery along with the cervical sympathetic plexus. In the upper part of the anterior wall, you're going to find the upper canal for tensor tympani muscle, and the lower part you're going to find the lower canal for auditory tube. The posterior wall, has lots of parts. Suppose upper part has the opening for adytus to the mastoid antrum. Adytus means a small opening or hiatal opening, and mastoid antrum is kind of air sinus. We'll talk about later, not now. Just lower part to this adytus of the mastoid antrum, you're going to find a fossa or a depressed area, which is known as fossa inquidis. Inquidis or inquidis, you can say whatever you want. Lower to this part, fossa inquidis, you're going to find a bony canal where the facial nerve passes. Okay, from this facial canal, a hollow, prominent, a bony projection arises, as you can see in this photo. This pyramidal shaped eminence or projection, it consists of stapedius muscle. Okay, and now the medial wall, here you're going to find the lots of names. First of all, you're going to find promontory. It is a rounded elevation made by the cochlea. It has lots of turns. Among the basal turn of this cochlea forms this promontory. What is cochlea? We'll talk about in inner ear video, not now. And then you're going to find fenestra vestibuli, which is also known as fenestra ovalis. It is a oval shaped or a reniform aperture behind and above the promontory. This opening is closed by the base of the stapes bone along with the annular ligament. And then you're going to find thirdly, fenestra cochlea. It is also known as fenestra rotunda. It's a small window, or it's also a kind of opening behind the promontory, and it is also closed by the tympanic membrane. Now behind the tympanic membrane, you're going to find another structure, sinus tympani, and the lateral wall, which is itself covered by the or made by the tympanic membrane. The medial surface of the tympanic membrane, which is covered by the partially mucous membrane. That's it, nothing else. As I said, this middle ear is a gap area or space. So it consists of so many structures, among them lots of arteries. First of all, you're going to find stylomastoid branch of posterior auricular artery, which is also known as occipital artery. Secondly, you're going to find anterior tympanic branch of maxillary artery. Thirdly, you're going to find petrosal branch of middle meningeal artery. Fourthly, you're going to find superior tympanic branch of middle meningeal artery. Fifth, you're going to find branches from ascending pharyngeal artery and artery to pterygoid canal. And then you're going to find tympanic branches of internal carotid artery along with the lots of nerve you're going to find in this space. First of all, superior inferior carotico-tympanic nerves, tympanic branch of glossopharyngeal nerve, then chorda tympani nerve, and then lastly you're going to find facial nerve. So all these nerves and all this artery gives few branch to these surrounding structures of the middle ear. Okay, so I hope you a little bit understand about this complex part in brief, and see you soon in my next video. Till then, bye.